Hi, I'm Dr. Hila Isak, and I am the site director for the San Jose Community Medicine Fellowship, and I work closely with Dr. Kim Hartwig. We are the team that works on our community medicine rotation, and we are really excited about starting our fellowship here in San Jose. So we decided to focus our fellowship on vulnerable populations because here in Silicon Valley, we're in an area where there is a lot of money, but there is a lot of disparities as well, financial, language access, healthcare, and so we wanted to make sure that our fellow got the opportunity to work with these different groups, whether they be undocumented immigrants, homeless, refugees. We think that there's a lot here in San Jose, and we think there's a lot of good learning to be done. I'm really excited about our program here in San Jose because I think that we've partnered with a lot of great clinics. Our first clinic that we have been working with the most is Washington Health Clinic, and it's a school-based clinic, and the population is really adults, pediatrics, women's health. Most of the patients speak Spanish. Many of them are undocumented, and so we are really able to kind of provide that full breadth of family medicine care. Our other clinic is John the 23rd, and that really focuses on the homeless population as well as a reentry program. And so that's something that I think will be a really great asset for our fellow as well. It's also in downtown San Jose. And the last clinic is the Aki Clinic, and their focus is on the refugee population, and that's in East San Jose. So I think we have a really great breadth of experience, not even including the non-clinical things that we're looking for our fellow to do.
So Kaiser has some programs within Kaiser that we work in together with collaboration with the community, and one of those programs is the ACEs team. The ACEs team or committee is a program that works on adverse childhood experiences. And with the adverse childhood experiences, we want to learn to integrate this into our healthcare with all of our visits for our children. With Kaiser, they are forming different ways in order for that to integrate into our clinic system. Washington Clinic has come up with the Uplift program, or working with the Uplift program, and in that they will be integrating also the ACEs program into their community. So the fellow will be involved in both creating the program and also implementing the programs.
We're really excited for our fellow to actually participate in teaching. The first thing that we're going to have them do is they are going to be the preceptors at our community clinic. And so they're going to be precepting first, second, and the third year residents. So that's going to be great to educate the residents in terms of community medicine. The other thing we're hoping our fellow is going to participate in is Wednesday didactics. And so helping out with lectures, providing any kind of problem-based learning sessions. And then finally, our global health trip that will be happening in the springtime. The fellow will be the one who's going to be taking the third year residents on the trip. So there will be a lot of time for them to provide education there. So the fellow is going to be a part of the Summer Pathways program. It's a program that we have here at San Jose Kaiser where there's a group of high school students who are interested in healthcare. So not just becoming a doctor, but rather all of healthcare. And we're trying to expose them to the different opportunities. And so it's 1 week in July and 1 week in August, and these high school students are able to come on campus, talk to different workers at Kaiser, and we're hoping our fellow is going to be a part of that along with our residents, trying to, again, teach them, come up with PBLs, things of that nature. And again, the idea is to work on a pipeline program to get high school students who may be coming from low or moderate income households, who may have parents who've never graduated from high school or college, and really give them that exposure so that they can make the right decisions early on. So I think what is really exciting when you're a part of something at the beginning is that you can really mold it into what you want it to be, bring your ideas, and also make great relationships with the community. I think that you can be a part of building something that's lasting. And so that I think is going to be great for the fellow. In terms of a con, I think there's going to be a big learning curve, but I actually think that that's probably going to be pretty fun too. So we'll be learning together, but I think that there's a lot of pros, and we're really excited and have a lot of great faculty that's excited to bring the fellow on. All the attendings at our residency program is really excited to teach, and so I think the fellow is going to be able to experience that. I think also as someone who is a native from San Jose, there's just so much to do, wonderful hikes, the beach is pretty close, you're not too far from San Francisco, so there's a lot to do here, and so I think the fellow will have a great experience in that respect. And my hope really with this fellowship is that we are able to provide the fellow some opportunities within our system here at Kaiser, seeing how it works, but then also that experience out in the community. And we are hoping that we are going to nurture whatever you are interested in. We are going to foster all of your interests, and really we're going to have people who are going to make changes in San Jose. We're hoping that you guys are going to change the world, and I think that's going to be the best part of it.